Hi, so today I'll be talking about the safe drug consumption facilities, the pros, cons, and what I would do as a policymaker to address drug abuse and addiction in the United States. So, safe drug consumption facilities, or SDCFs, are a pretty controversial topic, so let's break it down by looking at the pros and cons. On the positive side, these facilities can save lives. Studies show that they significantly reduce overdose deaths. For example, a study from the Lancet, how do you say that, found a 35% drop in overdose deaths in areas around safe consumption sites in Vancouver, Canada. They also help prevent the spread of diseases like HIV and hepatitis C by providing clean needles and other resources. Another big pro is that these facilities connect people to healthcare and treatment programs. Many individuals who use these sites are referred to addiction treatments or social services. In Sydney, for example, over 70% of users at their medically supervised injecting center were linked to additional health and social services. That's a huge step towards helping people get the support they need. Of course, there are some challenges. Critics argue that these sites might enable drug use by normalizing it, and some worry they could increase drug related activity or crime in nearby areas. However, most research does not back that up. For instance, a study in the International Journal of Drug Policy found no increase in crime around safe consumption facilities. Still, the stigma and public perception of these facilities can make them hard to implement. If I were a policymaker, I take a balanced approach. I would invest in safe consumption facilities, but I also make sure they're a part of a larger plan that includes prevention and treatment. These facilities can't stand alone. They need to be a bridge to recovery. I'd also work on expanding access to treatment programs because right now, only about 10% of people who need substance abuse treatment actually get it. That's a major gap that we have to address. Finally, I put more effort into prevention through education. We need to teach young people about the risks of drug use early on, not just scare them, but give them real information and facts and support. At the end of the day, addiction is a public health issue, and we need policies that focus on harm reduction, education, and treatment rather than punishment. Thanks.